Hello students, this is Dr. Khatija. Welcome to formulation series. Today's formulation is Gandharvahastadi kashayam. It has only 8 ingredients in it. So the shloka goes like Gandharvahasta Chiruvilva Hutasha Vishwa Patya Punarnava Yavasaka Bhumi Talaihi. I'll repeat it, the ingredients again. Gandharva, it has only 8 ingredients. Gandharvahasta Chiruvilva Hutasha Vishwa Patya Punarnava Yavasaka Bhumi Talaihi. So the main ingredient is Gandharva Hasta and Chiruvilva. We have already seen the benefits of Chiruvilva in Chiruvilvadi Kashayam. It is given in Arsha and Bhagandhara Roga, which is Vata Kapha predominant. And it has Hutasha Vishwa and Hutasha and Vishwa. Hutasha here is Chitraka and Vishwa here is Shunti. Okay, so we got 4 ingredients over here. We got Gandharva Hasta, Chiruvilva, and Hutasha is again Chitraka, and Vishwa is Shunti. Okay, so we have learnt 4 ingredients here. And the next line is Patya Punarnava Yavasaka Bhumi Talaihi. In here, Patya is Haritaki. Punarnava, we know that it has Shofagna property. Yavasaka is Duralava. Duralava is, it can be acted as Daha Shamana drug. It is Rakta Pitta Hara also, and it has Vata Shamana property also. It also acts as a Shofagna property, and Punarnava also acts as a Shofagna property. So these two are meant for this, and Bhumi Talehi is Musli. Okay, so we have learnt the 8 ingredients. क्वातरस सैंधव गुडः पवनस्य शान्त्यै क्वातरस सैंधव गुडः. We in the next line they have mentioned the anupanam of this kashayam. They are asking to give it with saindava and guda. Okay, and then pavanasya shantyau. The indication is it helps in subsiding vata, and vahini balaya. It helps in strengthening the agni, ruchyo, and it helps to improve the taste, ruchi, and it helps in malashodhanaya. Okay, we will explain it detailedly in the next page. Okay, so the main indication is pavanasya shante vahni balaya ruchyo malashodhanaya. At least this line you have to mug up, and you should remember the 8 ingredients, and the anupanam for this drug is very important. We'll give this with Saindava and Guda. Okay, I'll read the shloka again. Gandharva Hasta Chiruvilva Hutasha Vishwa Patya Punarnava Yavasaka Bhumi Talaihi Kwata Saindava Gudaha Pavanasya Shantyo Vahni Balaya Ruchyo Malashodhanaya. And based upon this indication, we have just seen the Chikitsa Sutra of this indication. By keeping these 4 things in mind, we can give it in a variety of conditions like this. Okay, before reading this, I'll just show how it works. Okay, so what was the main function of this? The main function of this kashaya is it acts on vata. It acts on 2 vata, that is apanavayu over here and Samanavayu near the Agni. If we correct this, then the Anulomana Gati of Vata is attained. So this is the main property of this kashaya. So what is the function of Apanavayu? It resides in Shroni Vasta Medra Guru Gocharaha Shukra Artava Shakran Shukra, Artava, Shakran, Mutra, Garbha Nishkramana Kriyaha. This is the function of Apanavayu. Okay. And what is the use of Samana Vayu? Samano Agni Samipastaha. It resides close to the Samana Agni. And it helps in its function is Koshti Charati Sarvataha Annam Grihanati Pachati Vivecheti Munchati. It helps in Sarakitta Vibhajanam. Okay, from Sarakitta Vibhajanam to the process of Nishkramana Kriyaha. Samana and Apana has its function, and Apana has a bigger hand. It has function over Shukra Artava Shakran also. Okay, so this is the place where it happens. So in this shloka, we have seen that Pavanasya Shantyo, and it ends like Malashodhanaya. the condition where people come with complaints of constipation, there will be constipation and there will be a vata vitiation over this region. And if there is a vata vitiation over this region due to malabadha, the sacrum, if we turn it this way, it lies, the sacrum lies in this way, so there is a vata prakopa. So in many of the patients who come with kati graha with a history of constipation, people will prescribe Gandharvahastadi because there is Malabhatta and there is a Shulam in Kati region. So the Malashodhana will do a Shamana of Vata dosha. So in this way they give Gandharvahastadi kashayam. So if we do the Malashodhana, there will be a normal Anulomana Gati of Vata will be attained. And if Anulomana Gati of Apana Vayu is attained, then it will automatically cause the Samana Vayu to come in Anulomana Gati. And because of the correct flow of vata, the Agni's bala will be improved. If Agni is improved, there is no ama or sama. If there is no ama or sama, our ruchi will increase. So it has a shloka as ruchyav. Okay, so we have seen that first we do malashodhanaya, it causes the vata shamana and anulomana gati of vata. It further enhances the Agni and it causes ruchi because of removal of ama. Okay, so this is the condition. And we have seen that this is the region where it happens, so we generally prescribe it in Kati Graha. And in case of Vatarakta also, where there is a Pachana, it is actually a Pachana yoga where Pachana is necessary and Malabhaddhata is there. In that condition of Vatarakta also, we can give Gandharvahastadi kashayam along with other medications. And in case of Udavarta, because in Anulomana Gati of Vayu is attained with this kashayam. In Udavarta, what happens? Pratilomana Gati happens. If Udavarta, in Pratilomana Gati of Vata, Udavarta condition occurs, which will cause retrograde ejaculation of Shukra in this region. In females also dysamenorrhea can happen due to this. And if we go further, and in local regions we can find arshas due to Malabhaddhata, and if Udavarta reaches above, it can further cause Shwasa and Kasa. In these conditions, if we give Shwasa Kasa medicines, it will not work. We will be needing a Virechana drug over here. So giving Gandharvahastadi in a Shwasa Kasa where Malabhaddhata is there is with this concept. Okay, so we should not directly treat the symptoms, we should find the cause and treat it. So in Udavarta Janya Kasa Shwasa Chardi, Gandharvahastadi can be given, and in Sthana Visheshata it can be given in Shukravaha Reto Graha conditions also. Okay, so now we'll go and read the indications once. Now we will understand why it can be given in these conditions also. It can be given in Agnimandya, Vataroga, Malasanga, Pakvashaya, Vata Prakopa also. Katigraha, we have seen the reason, and Vriddhi because of Vata, Gridrasi also because in Kati Pradesha there is a Visheshan of Vata, so the Vata is going in that Kati. So in that, keeping that in mind, we can give this. Locally, we can give an Arshas, Gulma, and Udavarta. This Shwasa Kasa is Udavarta Janya Kasa Shwasa Hridroga. And in Ama condition of Vadarakta, where Malabhaddhata is there, Shuklavaha Sroto Roga. And in cases of IVDP, we have already seen. In cases of Shukravaha Sroto Roga, dysmenorrhea, retrograde ejaculation, and in inflammatory arthritis, we can give this. It has Punarnava and Danyavasa, that is Duralabha, which acts as Shofagnam. So it can be given in inflammatory arthritis and in Vatarakta. But main indications we give is in keeping the 4 lines of Chikitsa Sutra. We have to keep this in mind. Okay. Gandharvahasta Chiruvilva Hutasha Vishva Patya Punarnavaya Vasaka Bhumitalaihi. Okay. Kvata Sasaindava Gudaha. This is the Anupana. Pavanasya Shantyo Vahnibalaya Ruchu Malashodhanaya. This is the indication. Pavanasya Shantyo Vahnibalaya Ruchu Malashodhanaya. Okay. Thank you.